let me open this sucker up and show you guys here. So it has a little handle here, and you'll see what else this little handle does here in a minute. It has grips. Where's the white end? Grips here on the sides, right there, to hold on to, because we're going to hold it like that. Okay. There's a little white button here, and I'll show you that here now. It doesn't want to come on. There we go. Do not touch the white button until it's time to touch the white button. That's why we hold it like this and not like this, because you might bump that button on top. So you're holding it from the sides like this, okay? And I'll show you what the white button does here in a minute. Oh, what I didn't show you was, because I feel like I'm being rushed because you took too long in there, right? Don't worry, don't post that, Gifty. Come on now.
So you want to restart it?
No, I'm just kidding. That's fine. So some of you might have thought, and that's fine, because I thought this too before I got into medicine, that the IV was a needle inside your arm. It is not a needle inside your arm. This is what's inside your arm, not a needle. It's made of silicone, very flexible, okay? And then, so here, if you guys want, oh, I got blood everywhere. That's not blood, it's Kool-Aid, you're fine. And take a look at that. That's all that's in your arm right there, which is right here. So the needle is inside, over top of the needle is this.
Ooh.
Just like that. They call it an over the needle catheter. That's what that's called. Because literally the catheter is over top of the needle, just like that. Okay, so you use the needle to get in, and then once I'm in the vein, you then slide the catheter into the vein, just like that. Now, once it's in the vein, this is what happens. See my needle right here? Mm-hmm. Now the button I told you not to push until it's time, once you push it, it goes. The needle's now inside of here. All that's left now is the catheter inside the patient's vein. Okay? Oh. Isn't that genius? It's genius, right?
It is.
This just goes in the sharps container once we're done. Okay. So that's the first piece of equipment. Thank you. Okay. So let me open one of those, because I'm getting set up to start the IV. Ooh, you guys make me nervous, Gifty. Jeez. So no, you're fine. I'm just kidding. So I have my catheter here. That's the first piece of equipment. The next thing you're going to need is transparent dressing, or we call it an opsite. Okay? Or Tegaderm is another name for it. There's all kinds of names, but transparent dressing for NCLEX, that's what they use. So I'll open this guy up. And the reason it's transparent, well, duh, so you can see what's going on underneath your actual IV. So you can tell if there's any inflammation, redness, bleeding, all that kind of stuff. So I'll just set that right there in my garbage pile over there. Need another 2x2. You'll see why here in a minute. Set that aside.
Is the transparent dressing like for security too?
Yes, it's to occlude it, so to prevent infection as well. Correct. Got my alcohol pads, of course. I need those. Did you guys see on the group, did she post that picture? Brittany took a picture of all the equipment set up and ready to go. Mm-hmm. Good. Okay, so you guys don't need to do that then. Good. Okay, and oh, I'm missing that. Where'd it go? Did she only give me one of those? Are you kidding me? Oh, here we are. All right. And then what else you need is this, which is this piece that I took out of the old one right here. Remember I said PRN adapter, heparin lock, med lock, all those kind of things? Well, the new name is PRN adapter. Okay, it's got 6 different names to it, right? So we can call it a hep lock, we can call it a med lock, we can call it a PRN adapter, we can call it a saline lock. At any rate, it's the thing that attaches to the IV so you have access anytime you need it. Okay, that is in the package right here. Okay, we need to get that out and ready to go. So I'm going to open the package. Okay. Okay, I'm going to keep the cap on this one right here. So there's 2 sides. The white side is where I attach my syringes to flush and to attach solutions to. The clear side is what I attach to my patient. Right there. This attaches to that little blue thing that's inside the patient right there. I taught you guys a word yesterday. We need to prime this. So what does that mean? To prime means to what? To get the air out. We're going to pretend that this doesn't have a bunch of pink stuff in here. This is saline right here. So before you start, you're going to have this pushes and twists onto there, because there's a little spring at the end. That blue is a little spring there. You push and twist that on, and we prime it and get all the air out just until we get a couple drops out. Boom, boom, boom. There we go. And we're gonna set that back inside of our sterile package to keep it sterile. Okay, so that's all set, ready to go. Got my gloves, I'm all ready. Now let's do our IV. I'm gonna get this done in time, you watch me.
I'm watching.
You watch Sierra, all right. Don't forget your tape, just like we did for the blood draws. Get a piece out, ready to go like this.
Pressure's on.
I'll remove my old thing here. Got a little mess there, I'll clean that up. Okay, first step, just like blood draw, what is it?
Clean it.
Nope.
Assess.
Assess. Assess the arm. Here we're looking for a nice, straight, long vein. For blood draws, you just need a vein, period. For this, you need a long, straight path. Okay, so we're looking for that nice, long, straight path. Yep, this arm looks good. Next step, tourniquet, right?
Yeah.
After that, what's next?
Palpate.
Palpate. Just put my tourniquet on, and I palpate. Next,
Gloves and clean.
cleanse. Then gloves. There we go.
Oh, okay.
Inside out. Yeah, some of the steps aren't on like the boiled down steps that you guys are going to study over the weekend. So it's drying, I'm putting my gloves on. I now get out my over the needle catheter. Okay, loosen this up a bit. That's just one of my preferences, you don't have to do that. And then now we're going to watch, we're going to get a flash, okay? So we go in. Boom.
There you go.
Yay.
See? There's the flash right there. Once you get the flash, I'm going to take my finger in advance, just like I showed you, the catheter, into the vein. Okay?
Oh, that's what that's like.
I pop my tourniquet. This is what the 2x2 is for. I'm going to stick it under here so I'm not making a big old mess. The button I told you not to push, I'm going to push. Now he's bleeding like crazy, so I need to hurry up and attach this. Okay, notice I have not let go of this. If you let go of it, what's going to happen?
It's
It's going
gonna.
to fall right out, and then you got to stick them again. No one wants that. You will not have a happy camper on your hands. So I take my tape, and notice the part I'm going to tape down is the actual port. Not the port, but the actual screw-on adapter part right here. Okay, so that's taped down. I can now let go. Take my transparent dressing. Is
It's
tape?
okay.
Yes,
The catheter is sticking out.
it's fine.
Okay.
Watch, I'll fix it.
Okay. Watch.
I'll fix it.
I was thinking that too.
It's going to be like that because I have this tape down, it's pushing down, but once I put the clear transparent, it's going to push this down just like this.
Okay.
Is tape sterile?
No.
No. So that's why the tape did not go on here
Okay.
because this needs to remain sterile. This is sterile. I'm going to take this and put it over top of here and get everything lined up just like that. So now it's going to freak you out less, so it's not sticking up as much as it was. It's okay if it's sticking out a little bit because it's all covered up. Okay, I'm going to remove my transparent dressing. I'm going to pat it down as I go across so it's nice and secure. Okay, on here, there's a little piece of, little marker on there right there. Does anyone have a pen on them?
Very good.
Okay. You're gonna write date, today's 5/11/18, time 12:52, initial, and you can even put the gauge if you want on there. Do this with gloves on, that's pretty, that takes some skill right there.
Skills.
Skills. You want to put this somewhere, just not covering the actual site itself. We still got this attached. You think we're going to leave the room like this?
No.
Well, it's on here. The reason why it's on here is because we need to flush the IV. You can't really flush these. Oh, see that big old air bubble on there? That shouldn't have been there. There you go. I'm going to flush, and then I'm going to clamp it off like that. This just unscrews, and you won't bleed because it's got a little valve at the end right there. Last piece of tape. I'm going to tape. The J-loop is another name for, oh, it has another name. It's called a J-loop. There you go.
J-loop.
Yep, because look,
Oh.
makes a J, just like that. Why'd they give it 10 names? Who knows? I put it here, not up here, so that I can do this.
So, Mr. K, when you flush, you didn't use everything in there.
No, you don't have to.
Okay.
You're just flushing to make sure it's patent. That's the purpose of flushing.
Okay.
Because it's more or less checking to make sure that you're in the vein properly. I flush, and if it doesn't go anywhere, guess what? You're not in right.
Okay.
If you flush and it's nice and smooth, you're good to go.
Or what if it's like a blood clot or something?
If there's a blood clot,
Yeah.
it wouldn't clot right away. It might clot now. If you go to flush, come like back 10 minutes, like an hour later, and it won't flush, it probably is clotted off in there. Do not force it, because then you're going to push the blood clot, bust it loose.
Ooh.